Hello, my name is Carol Davis, and I'm Barnes myofascial release therapist, and I'm going to be demonstrating the use of myofascial release, one of the integrative therapies that we talk about in the chapter, for people with cardiopulmonary and respiratory and cardiac dysfunction. When we do myofascial release, we always start with a whole body evaluation. We look to see where the fascia, which runs in one continuous web from the top of the head all the way down to the bottom of the feet, where that fascia is being restricted and might be pulling and tugging in that web to disrupt the breath of the diaphragm and also the function around the heart. The cardiac muscle itself is embedded in fascia. The diaphragm is fascia. And so what we're trying to do is find those areas in the fascial web that are restricting good diaphragmatic function, good cardiac function. We start with an evaluation, but because in the interests of time, we didn't have time to demonstrate that to you. But what I'd like to do is show you a picture of how the fascia distorts the skeleton and the bones when it is restricted. And when the pelvis is not level, when the shoulders are not level, and when it looks like you have a long leg here, that's going to very much pull up, those restrictions are going to pull up into the diaphragm that sits right below the base of the ribs, and then up into the chest cavity, causing some restrictions around the heart. What we know from John Barnes' work and from science has documented the mechanism of action of why this works. Through our hands, we can actually release restrictions in the fascia with pressure and shear. The infrared energy from our hands helps to melt the polysaccharide ground substance of the fascia and then opens up the fascia so that it can take in fluid from the circulatory system and be able then to take the pressure off of the cells of the diaphragm, the cells of the heart. So I've now evaluated my patient, and she's waiting for me to be able to do the releases that I'm going to show you now. First, I'd like to put a soft ball between her shoulder blades so that we can get her pectoral muscles back, her shoulders back, so that we can open up the heart and the lungs before we work. This is a soft ball that doesn't squash the lymphatics, and the skin and the fascia that the skin is embedded in then is able to give a little bit. So if you'd sit up for me a little bit, and I'm going to put it right between her shoulder blades at about T6. Now her shoulders are going to be able to come back, and we've opened up the whole thoracic cage. And now I'm going to do my release. I'm going to put one hand underneath the low thoracic, high lumbar vertebra, the other on top of, half on bone, half on soft tissue. And I'm going to just press and wait. And the fascia underneath my hands and between my hands is going to respond to that infrared energy and that pressure and shear. Now, the science behind this has been documented very nicely by the work done by Paul Stanley and Associates at the University of Arizona, and by Gerald Pollack and his associates at the University of Washington, talking about what happens to that polysaccharide ground substance when we press and shear. And then Donald Ingber from Boston, with his work in mechanotransduction and the piezoelectric effect, how this pressure and shear actually stimulates the piezoelectric effect and opens up the fascia so that the diaphragm can then open up and breathe. Take a nice big breath for me. And I can feel her ribs moving, and I might have taken some measurements before to see about rib motion before I began to be able to document the change. And I'm here for a good 5 minutes. I'm able to stay in one spot in this particular release and just allow the energy to move through the fascial web, around the diaphragm, around the ribs, opening it up. And then if I want to work on the thoracic around the cardiac area, a lot of people think that coronary artery disease is just due to fascial plaques. cholesterol plaques inside the intima of the artery. But the arteries, the coronary arteries on the outside of the heart are embedded in fascia. The heart itself is embedded in fascia. And when there are restrictions coming from the gut or the pelvis, pulling down on the diaphragm, pulling down on the ribs, collapsing people this way over the heart, your coronary arteries are definitely going to feel that pressure, and the blood is not going to be able to move, not just from the obstruction from the inside, but the obstruction from the outside. So I put one hand again underneath and put one hand right here in the middle, and I do the same thing, the transverse plane release over the web area of where the heart sits inside the body. Now, because it's a whole web, I don't have to be right on top of the heart. I don't have to be right on top of the diaphragm. If I'm in the web area, that energy is going to flow and find those restrictions, melt that polysaccharide ground substance. The fascia opens up, the fluid comes in from the circulatory system. People get up off the table and say, oh, I can take a deep breath. And it's such a relief for them to be able to feel the difference. Just these two simple transverse plane releases give 5 minutes in each of these areas. And then I probably would come up and open up the pectorals here so that I'd be up at her head and opening up the pectorals here, opening up so that the heart would have more room. So that's Barnes sustained release myofascial release. It's an integrative therapy because we're looking at the mind and the body. We're doing a holistic evaluation, and then as we work, we listen very carefully to what the body's teaching us about where the restrictions are. We find all of the restrictions and then take the pressure off of cells.